Hello, my name is Daniel Wolbrom. I'm a general surgery resident at Stony Brook University Hospital, and today I'll be presenting our research titled, Does the Implementation of an Emergency General Surgery Model Reduce Costs Associated with Cholecystectomies? These are my co-authors. We have no disclosures, no funding was obtained for this project, and there were no relevant conflicts of interest. So emergency general surgery, or EGS, is a novel effort towards providing streamlined and specialized care to patients presenting with acute care surgery needs. Previous studies have demonstrated improvements in length of stay, morbidity, readmission, and other measures of outcome with the implementation of an EGS model. Our study was a longitudinal observational study performed to evaluate the influence of the EGS service on total charges for cholecystectomies at a single academic hospital. Total charge was defined as all hospital-based charges billed for and did not include any physician fees. Using the New York State Sparks Administrative Database, we identified all adult patients that presented to the emergency department and underwent a cholecystectomy. The charges associated with cholecystectomy 3 years prior and 3 years following the implementation of the EGS service were analyzed and compared to similar institutions in our region. Total charge was compared using generalized linear models for a negative binomial distributed outcome and adjusted for significant risk factors in corresponding univariate regression models. 866 cholecystectomies were performed at our institution in the 6-year study period. 4,754 were performed at similar regional academic institutions, and 15,809 were performed at regional community institutions. Our institution saw a younger population compared to the regional academic and community hospitals, with only 40% of our patients being over the age of 50 years, compared to the total of 53% being over 50 years of age. The gender of our patients were similar to the regional average across all academic and community hospitals. Looking at the race of the patients in our study, our institution saw more white patients overall compared to the average of 60% versus 69%, and less Hispanic, Black, and Asian patients. Finally, our patients tended to have more commercial insurance than the other academic and community hospitals in our region, 74 versus 63 and 65%, as well as less Medicare patients than the other hospitals, likely due to the previously noted trend of younger patients at our institution. In the 3 years prior to the implementation of the EGS model, our institution saw no statistically significant difference in total charges when compared to similar academic hospitals in our region, yet we did see higher charges at our institution compared to other regional community hospitals. In the 3 years following the implementation of the EGS model, our institution saw lower charges compared to both the community hospitals as well as academic hospitals. This is a forest plot highlighting the data that I previously mentioned, demonstrating that in the pre-EGS years, there was no statistically significant difference in costs comparing our institution to other regional academic hospitals, yet higher costs when compared to other regional community hospitals. On the bottom part of the forest plot, in the post-EGS years, we can see lower costs at our institution when compared to both community and academic hospitals in the region. In conclusion, the implementation of the EGS model at our academic hospital is associated with lower total charges compared with regional academic and community hospitals for all patients treated with cholecystectomy. In the future, we would like to apply this statistical analysis across the broader range of pathologies often treated by acute care surgery services, including but not limited to appendicitis, small bowel obstruction, and mesenteric ischemia. We would also like to identify the specific characteristics of the EGS model that specifically improve the healthcare economics of acute care surgery. Thank you.